Good evening friends, my name is Dr. Sushil Shinde. Today I'll be talking on infertility and IVF. Infertility, as we know, it's very rampant right now. Almost in 1 in 5 couples are suffering from infertility. So what do we mean by infertility? In infertility, a couple is not able to conceive after a year of marriage, and almost we say that almost in 1.5 years 98% of the couples do conceive. So then it is very important to know that these patients are going to need some form of treatment or help from a consultant. So what do we know about infertility? That there are many causes of it, but if we broadly classify them, it would be a male factor almost about 40%, female factors causing almost 40% of infertility, about 10% being both the partners being responsible for infertility, and almost 10% when we can't find the cause, we call it as unexplained infertility. So what all things we do in treatment is depending upon the causes of it, but overall what we require is to give a couple a child. So what we call it as, in patients of unexplained infertility, we give an accelerated IVF or accelerated infertility treatment for them. So what do we do in this? We evaluate the patient, we see how is the blood count, the AMH count, and the semen parameter of the male partner. After evaluating that, we ask them to go ahead and go for IUI cycles. In case the couple doesn't conceive in IUI cycles, then these patients are being advised to do IVF cycle. What do we do in IVF? In vitro fertilization is a full form of IVF. In a layman term, it is called as testing baby. In this, what we do, we give hormonal injections, which we all know, we hear that the hormone injections are there and all. So we give this to the female partner so that we increase the ovulation, we increase the follicles in the patients, in the ovaries, and have almost optimal number, almost about 8 to 10 follicles in the ovum pickup, so that we are able to fertilize all these eggs and then make embryos of it, and then we can keep them, and like we can freeze these embryos for multiple trials, for multiple transfers. So what is the advantage of this? That we get a good number of embryos in one IVF cycle itself. So what is the advantage? So basically all the pregnancies and all the IVF treatment, the percentage, the success rate depends upon the male partner. Like if the age of the female partner is very important. Usually we say almost when the age is less than 30 years, it goes to about 50 to 55% of the pregnancy rate. Secondly, if you go ahead, if the age is almost 40 above, then the pregnancy rate even in IVF cycle drops almost about 10 to 15%. So all these things we are supposed to be like taking care of while starting the treatment for the patient. So always sensitize the patient that the female partner age is very important and is the most deciding factor for the pregnancy. So the earlier they start the treatment is better for them. Now coming to IVF, like what is the procedure in IVF? In this, what we do, we ask the patient to have like different protocols are there. We call it long protocol or interference protocol, in which we give FSH or HMG injections which we have. Those will increase the number of follicle size, and then once the follicle size increase to an appropriate almost about 18 to 20 millimeter, we then ask the patient to undergo ovum pickup, that is the oocyte retrieval, in which we get all the oocytes outside in the lab. Then we fertilize them either by doing IVF, that is in vitro fertilization, or by doing ICSI, that is intracytoplasmic sperm injection, and making embryos of those fertilized eggs. Then seeing the grading of those embryos and deciding on which day you want to do the embryo transfer. We can do it on day 3 or we can do it on day 5. Once the embryo transfer is been done, the patient is advised few medications like estrogen and progesterone support, so that it becomes well implanted and it helps for the pregnancy to grow. And after almost 13 days, we do the blood test called as beta HCG blood test. After this beta HCG blood test is positive, we ask the patient to again have the routine protocols for any antenatal pregnancy, because IVF is not any different. Only few injections or few medicines that the patient might have to take because of IVF treatment. That are the only changes which we do it in IVF for IVF pregnancy as such. So overall, it is the same pregnancy which a couple can have naturally also. So then there is nothing like there has to be bed rest every time, the patient has to be bedridden and all, nothing like that. The patient can have the normal life, normal day-to-day activity. That would not have any problem in IVF pregnancy also. I hope that I have made myself clear in this small short video. I'll be discussing many topics in front like upcoming, and it would be helpful for the patients and the couples. Thank you.